Hi, I'm Marc Sabatine, the chair of the TIMI study group in Boston, and I'm here at ACC 2018. I'd like to start by comparing and contrasting ODYSSEY Outcomes with FOURIER. Both trials looked at patients with atherosclerotic cardiovascular disease. FOURIER was a broader population that included patients with a history of MI. On average, patients were about 3 years out from their MI, or they could have had a history of stroke or have symptomatic PAD. ODYSSEY Outcomes looked at a narrower population of patients with a recent acute coronary syndrome, or 4 to 52 weeks, so focused really on coronary patients. That was really the primary difference in terms of the types of patients. There were some differences in terms of the proportions who were on high-intensity statin. It was somewhat higher in ODYSSEY Outcomes, as one might expect for patients who had just recently had an acute coronary syndrome. So an important difference is the dosing regimen between the two trials. And so in FOURIER, it adopted an approach of treating patients with maximal dose of evolocumab. ODYSSEY Outcomes took a different approach and targeted really a range between 25 and 50 milligrams per deciliter, and so started with a lower dose and then would up or down titrate based on what the patient's LDL cholesterol was. That resulted in 7 or 8% of patients in the alirocumab arm ultimately having study drug discontinued because their LDL cholesterol fell below 15 milligrams per deciliter. The outcomes were somewhat different. In FOURIER, we had a very broad quintuple outcome. Primary endpoint, that was CV, death, MI, stroke, hospitalization for unstable angina or any coronary revasc. ODYSSEY Outcomes, it was a somewhat narrower outcome for coronary heart death. MI, stroke, or hospitalization for unstable angina required, amongst other things, that patients had to have angiographic evidence of quite severe coronary disease. The other probably critical difference between the two trials was then the duration of follow-up. And in FOURIER, the median duration of the trial was only about 2 years, 2.2 years. ODYSSEY Outcomes was longer, approaching 3 years. When you look at the results for the trials, the spread in LDL cholesterol was a little bit less in ODYSSEY Outcomes, and again, attention to treat analysis, and even a little bit in the on-treatment, the LDL cholesterol levels drifted up a bit. The implication was that neutralizing antibodies were not a problem. In terms of outcomes, there was a 15% reduction in their quadruple endpoint, with, in general, consistency for all the different components. Interestingly, even for all-cause mortality, a nominally statistically significant reduction. Overall, I think that message is quite good, because people were concerned after FOURIER that even though our trial was relatively short, we didn't see an effect on cardiovascular mortality. Now with ODYSSEY Outcomes that went longer, we saw in the data presented today the curves for mortality starting to diverge. It took about a year and a half or so to diverge. It's exactly what was seen in the 4S trial. It's exactly what was seen in the lipid trial. Underscores that, one, it takes time for lipid lowering to translate into a benefit, particularly for mortality. Two, if you give it enough time, that PCSK9 inhibitors should be no different than statins in terms of achieving reductions in fatal outcomes as well as non-fatal outcomes.